So if you've got a client and they're coming in with really acute low back pain and they're really nervous to move, I want to show you a few exercises that I like to do that can be pretty safe, but also get them moving in a very sort of closed chain manner. So the first one is going to be on their backs. We're working through just some mat exercises, but the reformer can really assist with that by adding a little bit more if they feel comfortable doing that. So I've got my footwork settings on, which are 1 and 1. So gear bar is at 1 all the way that way, stopper is at 1 all the way that way, and I'm going to have 1.5 springs, so fairly light, not too heavy. We're going to come onto our backs here. And we're just going to start with some pelvic rocking. So trying to go through a gentle posterior tilt with lumbar flexion, seeing if they're able to kind of allow that lengthening to happen. You can also take this into some knee drop work. So while they're here, we can think of finding deep core, some TA, dropping one knee out at a time. Having this degree of hip flexion can be really comforting for a lot of clients. They feel contained. It doesn't feel as scary. But again, we all know that it's really important to maintain that deep core activation when someone is going through an acute episode. If you want to add some arms, you can also do the opposite arm with the leg, making sure the pelvis isn't tipping too much. So you're going to cue for that inhale and exhale to compress, finding that deep core connection, and then dropping opposite arm and leg out, and then the other. So going back to those pelvic rocks, we're going to peel up into a little bit of a hip roll. And if they feel comfortable, they can come all the way up and then all the way back down. Release the glutes nice and wide. And again, gathering the glutes, feeling the lumbar spine, fanning in the back, opening up here, feeling the glutes turn on, and then coming down slowly. If your client is feeling well enough, they can also go into a leg press. So coming up, making sure that there isn't a pillow under their necks when you lift, and then pressing away, and then back in, and melting back down. So again, it really depends on how comfortable your client is with a lot of these exercises. It really depends on their ability to move, and even getting into a lying down position on the reformer can be quite challenging. So just use your judgment. The other exercise I wanted to show you was coming onto your knees here. This is knee stretches with round back. So we're going to have stopper and gear bar staying at that 1 and 1 position all the way to the front. One heavy spring, or one red. Hands wide on the gear bar, and then feet here. Keeping that bum hovering over the heels, we're going to find some lumbar flexion. So you may start off just with, bringing the tailbone forward towards the knees and then releasing wide in the sit bones. This might be enough for your client, but if they can do a little bit more, you're going to come forward into flexion, and then as you come back, we're going to press out with the feet, turning on those glutes, pressing away long, and then rounding back in. So trying to maintain a little bit of lumbar flexion throughout while keeping the glutes active. It can be a tricky one to navigate, so if you have to reduce the range just to like a tiny little bit, that's totally fine too. Lastly, I'm going to show you Mermaid prep. We're going to have the legs sort of in this internally and externally rotated position if this is too much for your clients, which I imagine it might be for some of your clients that have acute low back pain. I would actually just have them dangle that leg off the front and then just have the one leg up here. One hand is forward on the foot bar. You're going to have one hand over, palm facing up. So pressing out, we're going to have a nice little side bend to stretch out and then come back in. So I do find that for this exercise, one spring can be a lot for some people, but if you want to reduce it, you can absolutely do that as well. If you want to make this exercise a little bit harder, you're going to add a bit of a twist. So we're going to come into that side bend, but then we're going to turn to face the floor, 2 hands wide onto that foot bar, and then we can do 3 presses if you'd like. So 1, 2, and 3. And you're gonna feel a big stretch in this position right here. So again, I would proceed with caution with this one, or just make sure you're starting off with a lighter spring. From here, we're gonna bring this back hand back towards the front, hold that side bend for a half second, and then come back and open up all the way. So Mermaid's a really great one, but again, with that added rotation, just be really, really careful with the spring weight that you're using. So those are the 3 exercises that I use really frequently with a lot of my clients with acute low back pain. Again, proceed with caution, don't push them, do what they can do. I would probably place the focus more so on getting the active release as opposed to pushing them through range. It really is a game of trying to get them to understand that they're holding tension perhaps where they shouldn't be, and allowing that tension to be let go.